Welcome to the Deep Dive, where we unlock the secrets hidden within, well, even some pretty unexpected subjects.
Hmm.
Today we're plunging into a veterinary enigma, equine thoracic trauma.
Right.
Now, it might sound maybe a bit niche, but trust me, understanding how vets uncover these invisible injuries and the, delicate dance of systems involved,
It's fascinating.
it really is. It offers these universally powerful insights into complex medical challenges. It's almost like a medical detective story.
Yeah, it kind of is.
And our mission, like always, is to cut through the complexity, pull out the most important nuggets of knowledge from our sources, and give you a real shortcut to being well-informed.
And it truly is a significant challenge in veterinary medicine. I mean, while equine thoracic trauma isn't something you see every single day,
Right.
when it does happen, it carries a profound risk. We're talking immediate and long-term life-threatening complications.
Oh.
These injuries, they directly impact the heart, lungs, major blood vessels, all absolutely vital for a horse to breathe, oxygenate its blood, maintain stable circulation,
Absolutely essential functions.
Exactly. And that's precisely why rapid assessment, triage, and immediate stabilization are just paramount for a positive outcome.
Okay, let's unpack this medical mystery then. At its most fundamental level, what exactly is thoracic trauma in horses?
Well, basically, the research we looked at puts it into two main categories.
Okay.
You've got penetrating trauma, where an object actually breaks the skin. Think collisions with fences, maybe barbed wire, that sort of thing.
Ouch. Okay.
And then there's blunt trauma. So that's an impact, but the skin isn't breached.
Right, like collisions, falls.
Yeah, collisions, falls, or even direct kicks from other horses. Those are common causes.
Now, when I think of trauma in horses, I tend to picture adults, maybe, race horses or something. But is there a specific age group that's surprisingly vulnerable to the blunt kind?
That's a great question, and here's a fact that often surprises people. Blunt trauma is actually quite frequent in neonatal foals, right at birth.
Newborns.
Really? Yeah. The statistics, they show it affects about 20% of newborn foals, especially those born to first-time mothers or mares having difficult births, what we call dystocia.
20%. Wow.
It is. And what's even more striking is, despite this relatively high incidence, these foals often show very few clinical signs.
So to be missed.
Easily.
Yeah.
The injury can easily go unnoticed. However, and this is important for those foals that are sick enough to be admitted to neonatal ICUs,
Okay.
fractured ribs were found in a staggering 65% of cases.
65%.
65. And tragically, mortality directly linked to these rib fractures can be as high as 25%.
Oh, wow.
It truly reveals a sort of hidden vulnerability in these young animals.
Okay, here's where it gets really interesting for me. Because the general idea of chest trauma sounds simple enough, but our sources reveal this whole array of specific injuries inside. And each one seems to have its own cascading effects. The key insight here isn't just knowing the names, I think, but understanding how they fit together, like a puzzle.
Exactly, it's the connections.
So, for instance, you've got common ones like fractured ribs, which, you can imagine cause immense pain
Terrible pain.
and often lead to hypoventilation. So the horse takes shallow, inefficient breaths.
That's right. They're guarding, trying not to move the painful area.
Then there's the more severe flail chest. That sounded pretty dramatic, where 3 or more ribs in a row are broken in at least 2 places.
Yes, flail chest is serious. It creates this unstable segment of the chest wall.
And it moves paradoxically. Inward on breathing in, outward on breathing out.
Precisely. It moves opposite to the rest of the chest. It's visually quite startling to see and really impairs breathing.
Sounds incredibly painful and debilitating.
It absolutely is.
Yeah.
And beyond the ribs themselves, our sources talk about pneumothorax.
Air in the chest cavity.
Right? Air that's escaped into the pleural space, that area between the lung and the chest wall. It causes the lung to collapse.
Okay. And hemothorax?
That's blood accumulating the same space, which can very quickly lead to hypovolemic shock, life-threatening shock from severe blood loss.
Got it. Air is pneumo, blood is hemo.
You got it. And we also see pulmonary contusions, basically deep lung bruises from compression,
Okay.
and pulmonary lacerations, which are actual traumatic tears of the lung tissue itself.
That sounds like a lot of distinct problems, but my understanding is that these things rarely happen in isolation. Is that right?
That's precisely the critical insight here.
Yeah.
Yes. What's truly fascinating, and often maybe overlooked, is the profound interconnectedness of these injuries.
Uh-huh.
Thoracic trauma almost never presents as just one single isolated problem.
It's like a domino effect.
Kind of, yeah.
Yeah.
For example, a seemingly straightforward rib fracture. Well, it can have far-reaching consequences if a splintered end acts like a sharp knife, basically.
Oh,
It penetrates deeper tissues that can directly cause a lung laceration, lead to hemothorax, or even result in a diaphragmatic rupture.
where abdominal stuff pushes into the chest.
Exactly. Abdominal contents protrude into the chest cavity. And similarly, even a subtle external sign, like subcutaneous emphysema.
That crackling feeling under the skin.
Yeah, it feels like tiny air bubbles, like bubble wrap. Even that can progress to a severe pneumothorax or maybe pneumomediastinum days or even weeks later.
Weeks later, how?
Well, movement, especially of the forelimb near the injury, can sort of pump air through a small wound or defect, allowing it to seep into those tissues over time.
Wow. Okay.
And all these individual injuries, they connect to broader systemic impacts, right? Impaired gas exchange,
Right.
whether it's from lung contusions, a collapsed lung, maybe an infection.
It all leads back to oxygen.
It inevitably leads to hypoxemia, that's dangerously low blood oxygen, and hypercarbia, high blood carbon dioxide.
Right.
And if there's significant hemorrhage, maybe from damaged major blood vessels, it can rapidly cause that hypovolemic shock we mentioned.
Where the body just can't get enough blood around.
Exactly. And think about the intense stabbing pain of fractured ribs we talked about. It's not just suffering, it acts like this cruel chokehold on their breathing.
Forcing those shallow breaths.
Right, shallow, ineffective breaths that just plummet their blood oxygen levels even further.
That interconnectedness, it really underscores why diagnosis must be so incredibly challenging.
Absolutely.
The research, it tells us the clinical presentation can be highly variable. And, crucially, signs might be delayed, sometimes 24 to 48 hours after the event.
That's right. The horse might seem okay initially.
And, even more critically, giving medications like NSAIDs, non-steroidal anti-inflammatories, and corticosteroids.
Which you often need to do for pain and inflammation.
Right, they're essential for comfort, but they can inadvertently mask or obscure the true severity or maybe the ongoing progression of the underlying injuries.
Exactly. The masking effect is a real issue.
So this means veterinarians have to approach every case with a really high index of suspicion, almost like medical detectives.
Absolutely.
Yeah.
You have to assume the worst until proven otherwise, in a way. The immediate priority is always triage, using the ABC protocol, airway, breathing, circulation adapted for horses, of course.
Okay, ABCs first.
Then a thorough physical examination is paramount. This includes carefully palpating the thoracic cage, feeling for fractured ribs, or that telltale subcutaneous emphysema.
That crackling.
Yep, and of course, auscultation, listening to the chest with a stethoscope, is key.
What are you listening for?
Well, absent lung sounds up high, dorsally, often suggests pneumothorax, the collapsed lung, while muffled sounds down low, ventrally, could indicate hemothorax, the blood accumulation.
Okay. So once that initial assessment is done, what tools are available to really, crack the code on these hidden injuries?
Good question. The material we reviewed highlights ultrasonography US as really the primary imaging modality.
Ultrasound first.
Often, yes, for diagnosing rib fractures and any associated fluid accumulations. It's also incredibly effective at detecting pneumothorax by looking for the absence of the normal glide sign of the lung.
Explain the glide sign.
Sure. Normally, the two layers of the pleura, the lining around the lungs, they slide smoothly against each other as the horse breathes. Ultrasound can see the sliding, or glide. If there's air trapped between them, like in pneumothorax, that sliding stops. No glide sign.
Ah, clever. Okay. Then there's thoracic radiography. X-rays.
Right, X-rays. They can identify fractured ribs, maybe foreign objects, fluid buildup too, but they do have limitations.
Like what?
Well, especially with the sheer size of an adult horse's chest and all that dense muscle mass. It can just obscure the view, make it hard to see subtle changes.
Right? That's a big animal.
It is. So what does this all mean for piecing together the diagnosis? It means no single imaging technique is usually sufficient on its own.
Okay.
Radiography, ultrasonography, and then the advanced tools like CT-computed tomography and MRI, magnetic resonance imaging, they all play complementary roles.
CT and MRI give more detail.
Incredibly detailed 3D views, yeah, both bone and soft tissue. But they often require general anesthesia for the horse.
Which has its own risks.
Exactly. And they are quite costly.
Yeah.
So the strategic selection of these tools, it's guided by what the vet suspects is going on, the horse's stability. Can it even tolerate lying down for a scan? And logistical things.
Makes sense.
It's all about getting the most appropriate diagnostic information at each step, building that complete picture of the damage.
Okay, so beyond imaging, fluid analysis is another critical piece of this puzzle, right? Specifically via thoracocentesis.
Yes, fluorocentesis. That's the procedure where you use a needle or catheter to aspirate or draw out air or fluid from that pleural cavity.
And why is that so important?
Well, the research indicates it's crucial for actually confirming effusion's fluid buildup and, really importantly, getting samples for detailed analysis in the lab.
But this raises an important question, doesn't it? While standard fluid parameters, like cell counts and protein levels, are useful.
They can sometimes be misleading, yes,
Mm.
especially in early sepsis, a severe infection, or even if the sample gets contaminated with blood during the collection itself.
Right. So not always clear-cut.
Not always. And this highlights a critical need for more sensitive, more specific tools. And here's where we get into the exciting promise of novel biomarkers and omics technologies.
Okay, what are those?
So researchers are exploring markers like myeloperoxidase and lysozyme. These are enzymes the body releases during inflammation and infection. Also, PCR for bacterial DNA, which can directly detect specific bacteria.
Find the culprit directly?
Potentially, yes.
Yeah.
And things like D-dimers or serum amyloid A, which are proteins that can signal clotting issues or systemic inflammation.
And the hope is these are more accurate.
The hope is they could potentially revolutionize our ability to detect critical conditions like septic pleuritis, that's infection of the pleural space, much more accurately and rapidly. Maybe even leading to rapid stall-side diagnostics in the future.
Wow, that would be a game changer.
You really would.
And rounding out this whole diagnostic picture is blood work, right? Acting as a sort of systemic health barometer.
Absolutely. A complete blood count, a CBC, that can show signs of anemia if there's significant blood loss, or it might indicate an infection.
Okay.
And biochemistry panels give us that snapshot of overall organ function, kidneys, liver, etc.
And to really understand the horse's physiological state, the nitty-gritty of oxygen and circulation.
That's where blood gas analysis and blood lactate levels come in. They provide crucial insights into how well tissues are actually getting oxygenated and whether the horse is in circulatory shock.
And this blood work, it also helps predict the outcome.
Yes, it serves as a powerful prognostic indicator. Specific parameters like elevated BUN, blood urea, nitrogen hypotassium, or hyperkalemia, high lactate hyperlactatemia, and low oxygen saturation. Those were explicitly associated with a poor outcome in trauma patients.
So they're critical red flags.
Very critical for guiding treatment decisions and assessing the patient's chances of recovery.
So, okay, once these hidden injuries are diagnosed, what's the immediate action plan? How do vets prioritize treatment when dealing with something so complex, so potentially life-threatening?
Right, this is the make or break phase, really. The primary aims, they boil down to a few key things.
Okay.
Supporting respiratory function is number one. Aggressively treating shock if it's present. Closing any open wounds immediately. And then administering broad-spectrum antibiotics to prevent infection, anti-inflammatory drugs, and crucially, analgesics for pain relief.
And the immediate stabilization efforts.
Often involve oxygen supplementation. That can be given via a tube in the nostril nasal insufflation or sometimes directly into the trachea. And intravenous fluid therapy is absolutely crucial to combat shock and dehydration.
It sounds like pain management is incredibly important here, not just for the horse's comfort, but for its actual ability to recover.
Precisely. You hit the nail on the head. Severe pain doesn't just cause immense suffering, it directly makes breathing worse by causing that shallow, painful respiration.
So what's used for pain?
Vets use NSAIDs like flunixin, meglumine, opioids, and sometimes regional anesthesia like injecting anesthetic near the nerves between the ribs, and intercostal nerve block for rib fractures specifically.
Oh.
And this leads us to what the sources call the delicate balance of inflammation control.
Delicate balance.
Yeah, because inflammation, it's crucial for starting the healing process, right? But excessive inflammation, or inflammation that goes on too long, can actually be detrimental. It can cause further tissue damage.
So it's a double-edged sword.
It really is. NSAIDs and corticosteroids, while necessary for pain and inflammation, can inadvertently slow down natural healing or cause systemic side effects, things like gut ulcers, kidney damage, especially if the horse is dehydrated.
Right.
So there's ongoing research into more targeted therapies, like IRAP interleukin-1 receptor antagonist protein. The aim is to achieve more nuanced control, blocking inflammation more precisely with fewer broad side effects.
Interesting. Now, for those penetrating chest injuries, the ones with open wounds?
Meticulous wound care is absolutely critical there. It means thorough cleaning, debridement that's removing damaged or dead tissue.
Moving none of the bad stuff out.
Exactly. And then the immediate application of airtight dressings Things like sterile plastic wrap or special petrolatum dressings
Why airtight?
to prevent any more air or debris from getting sucked into the chest cavity, which could worsen a pneumothorax or introduce infection
Got it. Seal it off quickly.
immediately. And here's a non-negotiable aspect for any horse with an open wound, especially a deep one like this.
Let me guess. Tetanus.
Tetanus prophylaxis, absolutely paramount for horses. They are highly susceptible to Clostridium tetani, the bacterium that causes tetanus, or lockjaw.
And there are two types of protection, right?
That's right. We differentiate between tetanus toxoid, that's the vaccine, provides long-term active immunity.
If they're already vaccinated.
Correct. And tetanus antitoxin, or TAT. That provides immediate but short-term passive immunity. It's used in emergencies, like for unvaccinated horses or ones with unknown history.
Okay, good distinction. Now, in cases of pneumothorax that trapped air and hemothorax that trapped blood, what are the specific interventions?
Often, it involves drainage, getting that air or blood out of the pleural cavity.
How?
It can be done via thoracocentesis, just drawing fluid or air out with a needle, like we discussed for diagnosis, or, more commonly for ongoing issues, by inserting chest tubes for continuous drainage over time.
And when might surgery be needed?
Surgery might be necessary for those conditions if drainage isn't enough, or for certain rib fractures like ones that are markedly displaced, poking inwards, or maybe near vital organs. And definitely for flail chest cases sometimes.
Okay. So during recovery, what's the focus?
Continuous monitoring is essential. Watching the horse's respiratory rate, heart rate, checking blood parameters regularly.
Looking for trouble signs.
Exactly.
Yeah.
We need to be vigilant for possible complications. These like the pneumothorax or hemothorax coming back or developing myothorax, that's pus in the chest, an infection or bacterial pneumonia.
And what influences the overall prognosis? The chances of recovery?
Well, the factors influencing prognosis are significant. For example, attention pneumothorax, where air pressure rapidly builds up and collapses the lung and even pushes on the heart.
Sounds bad.
It is. That or cardiac tamponade, where blood accumulates around the heart and literally squeezes it, or a major blood vessel injury, those all carry a poor prognosis, often because they can be rapidly fatal.
But if it's less severe,
Right. If the injury isn't that severe and, crucially, doesn't involve those large vessels, the heart, or extend into the abdominal cavity, then full recovery is generally expected with prompt and appropriate treatment.
so as we bring this deep dive to a close, it's crystal clear that successfully managing equine thoracic trauma relies on, well, first, rapid and accurate diagnosis, often like solving a really complex puzzle,
Definitely like a puzzle.
followed by a meticulously tailored dynamic treatment plan. This deep dive has hopefully given you, our listener, a significant shortcut to truly understanding a complex, fascinating medical challenge.
Absolutely. And if we connect this to the bigger picture for just a moment, consider how the principles we've discussed today, the profound interconnectedness of body systems, the diagnostic challenges posed by subtle signs and those masking effects of medication,
Right.
and the delicate balance required in treatment. These things aren't unique to horses, are they?
That's a great point.
So what insights does this deep dive offer us about approaching complex medical issues in any species, including ourselves? And maybe about the continuous need for critical thinking, adaptation, and those multidisciplinary approaches in healthcare? Something to think about.